Good morning, everyone. I see people joining, so I'll give it maybe 30 more seconds. I see the numbers climbing, and then we'll get started. Okay, I'll get started. So welcome, everyone. Thank you for joining us for our webinar today. Of course, it's Brain Injury 101 in Falls, and so we're very excited because this is Falls Prevention Week, so great tie-in, and we're ready to get started. Just some quick Zoom webinar features. Of course, we're in webinar mode, so you're automatically muted and you can't see other participants. You'll just see the speakers and the host. You'll ask your questions via the chat box, and so we'll be monitoring that as we go through the webinar. The session is recorded and will be available to you after today's session. So you'll get a follow-up email. Will also be on the Centralina website right there that's posted. So just know that if you want to go back to it or anyone missed it, it will be posted on our website. And so we want to welcome Brad Blackwell. He's our speaker for today's webinar. Brad has been with the Brain Injury Association of North Carolina since 2023 as a statewide training coordinator. Brad works to educate individuals who are thriving with brain injuries, their families, and also professionals. During his time with the Americorps and VISTA, Brad developed an unquenchable fervor to contribute to the process of dismantling systemic and institutional barriers that act as a conduit through the shameful condition of social and economic inequity. And he's very excited to be presenting today, so I'll turn it over to him.
Well, good morning, everyone. I hope you all are doing well. Again, my name is Brad Blackwell, and I am the Statewide Training Coordinator with the Brain Injury Association of North Carolina. I want to thank Centralina for inviting or for working together to provide this webinar for everyone this morning. Today, what we will focus on is brain injury, slips, trips, and falls, but primarily focusing on falls prevention and the relationship between falls and brain injury. And first, what can we do to educate and engage folks in the prevention of brain injury as it relates to falls? And we also want to talk about how that changes and impacts individuals in their community lives, not only in their own personal lives, but lives of the caregivers, families, and friends, and also just how they interact with the world. And then we also today we'll just sort of share some information and talk about one, how do we encourage and empower folks to think about how they can prevent falls in their lives. And then if the unfortunate event happens that a fall does occur, how do we empower and support folks and provide strategies to move forward and to continue to live a well-lived life. So that's sort of, that will be the focus of our conversation this morning. So here's a fact. I believe a lot of us know this, but in fact, it of course is true. Falls are for older adults. 1 out of 4 of older adults will fall each year. So it is one of the primary causes of brain injury, particularly in older adults. And this, of course, is unfortunately the leading cause of injury and injury death in people 65 years or older. So we know that 1 out of every 5 falls causes serious injury, such as broken bones, and in the case of our conversation today, head injury. And of all the TBIs that are recorded, not only across the country, but also in North Carolina, falls are the leading cause of emergency room visits, hospitalizations, and death. So let's just give a quick overview of brain injury. What is brain injury? So you'll see at the top here, we have this term acquired brain injury or ABI. And so think of ABI as sort of like an umbrella. And underneath that umbrella, we have non-traumatic brain injury and we have traumatic brain injury. So when we think about non-traumatic brain injury, we think about causes that happen inside of the body. Um, so for instance, we think about strokes, heart attacks, aneurysms, tumors, or other chronic illnesses that impact or affect the brain's functionality or its ability to function properly. Next, we have traumatic brain injury. And I believe most folks are a bit more familiar with traumatic brain injury, perhaps, than non-traumatic brain injury. But when we think about traumatic brain injury, we think of things that are happening to us outside of our bodies. So in this case, a fall or a vehicle or car accident, violence. We think about, domestic violence or intimate partner violence or surgeries. So these are sort of the two different types of brain injuries that exist from sort of a larger picture. But as I mentioned before, we have acquired brain injury, which is that umbrella term that we use. And today we're going to focus on the impacts and effects of both non-traumatic brain injury and traumatic brain injury, as both of these do have an impact on an individual's ability to live and lead that quality, well-lived life that we hope for everyone. So let's take a look at brain injury versus dementia versus normal aging, and we're primarily talking here and focusing on sort of how cognition and the brain sort of evolves, progresses as we get older. So we'll look at sort of the changes that occur, and we're going to sort of compare those between sort of the normal aging process and what that looks like, and then also what it looks like from dementia diseases perspective or point of view. So when we look or think about changes that occur between these two, we have sort of three categories that we primarily want to focus on. So for instance, the first, let's talk about remembering details. So as we think about aging normally, we find that sometimes it can be a little difficult to remember a conversation or event that took place in the past, or perhaps forgetting an acquaintance's name that you may have met at a social function some time ago. And these are thought to be sort of normal aging, part of the normal aging process for the brain. And then when we look at the same idea, but from the lens or through the lens of dementia diseases, it becomes very difficult to remember even the most recent events or conversations, and not just we're forgetting names of acquaintances, but also not quite always remembering the names of family members or those with whom we're the closest. So then we also think about forgetting words and just forgetting things in general. And part of the normal aging process is the occasional difficulty remembering, for instance, where did I put my keys? That happens to me all the time. I'm a big fan of AirTags. Or having a conversation and not quite being able to find the right word to use. Again, this is part of the normal aging process. But again, looking through the lens of dementia diseases, we find that there is frequent difficulty and sort of finding the words that you need to use to communicate the ideas that you're trying to express. So again, there's frequent difficulty through the lens of dementia diseases. And this also, you may notice, or folks also experience, having to take long pauses to think of, to really process and think about what words they really need to use to express the thoughts that they're trying to convey. And then also taking significant time to find this, substitutions to communicate the thoughts and ideas that you're trying to express. And then we think about awareness and alertness. And as we, again, age through the normal aging process, we tend to have personal worries about memory and changes. Folks often talk about, oh, I'm getting older. I'm forgetting where I put my wallet or my purse. And so, we're concerned about this. And then, folks often put things, strategies in place, maybe, putting keys or glasses in the same space all the time, just as a mechanism to help us remember where things are. But again, through the lens of dementia diseases, so we move from sort of this idea through normal aging, like our own personal worries and anxieties and concerns about, our ability to remember things, and sort of the changes and how our memory works. But again, through the lens of dementia diseases, the worry shifts from or includes not just an individual's personal worries, but also worries from relatives and their caregivers and their supports. So both the normal aging process and dementia diseases play a vital role in helping folks understand how to best prevent falling or prevent hurting themselves so that they are less likely to experience brain injury. And we'll go into this a bit further. So let's talk about the changes that happen after brain injury. There are lots of things that happen in the unfortunate occurrence or incident of having sustained or experienced brain injury. So let's look at physical and sensory first. And let's look at this through the lens of TBI, the traumatic brain injury side of acquired brain injury. There's seizures. Folks tend to experience seizures, headaches, and pain. And again, we'll get into this a bit deeper in terms of the severity, talking about the severity of the different gradations of brain injury. But in general, after brain injury, folks, can experience seizures, headaches, and pain. Folks can also experience weakness, in more severe circumstances or brain injury events, paralysis, balance and muscle, and difficulty coordinating with difficulty in muscle coordination. And then there's also sleep disruption and fatigue. So there can be, folks can sleep more, or folks can experience having less restful sleep. And then there are also sensory changes that may happen, just depending on sort of if there are any nerve damage, can impact our ability to feel and touch and be responsive, have our brains understand, how we are navigating the world and, the things that are around us. Picking up objects, for instance, can be impaired or challenging. In terms of the cognition, thinking, and processing piece, brain injury has a tremendous impact on this part of our brain. So again, remembering details and being able to recall events are often challenged. Mental flexibility and attention to detail and sequencing and learning. So following steps and being able to process new information in a way that makes sense for us can also be challenging. This creates confusion, and this also creates anxiety, and we'll get to that under the emotional and behavioral piece. And then there's also safety and awareness and the impulsivity piece. So just also depending on which part of the brain has been impacted or damaged by brain injury, the impulsivity piece and the safety awareness piece. So we're thinking about feeling concerned and anxious and perhaps a little depressed about, for instance, let's say we've had a fall, being anxious and nervous about, will I fall again? What do I do to make sure that this doesn't happen again? Do I need to leave the house? Do I just need to be sedentary? So these are all worries and concerns and anxieties that play a part in our sort of thinking and processing piece. And then you have the impulsivity as well. So, this idea of not really thinking through our decisions and our behaviors, just sort of doing them without really taking in consideration the consequences that may happen, having not thought about what we're doing, or what behaviors in which we're engaging. And then there's also the problem solving piece. And don't worry, everyone, we have some great, we have some, this sounds like gloom and doom, but we have some great supports and some great prevention strategies that we'll talk about later. But in terms of the cognition piece, the problem solving can often be impacted. Something as simple as trying to decide where to navigate in the grocery store when shopping. What aisle do I need to go down first? We may have had a routine in the past that we always follow when we go grocery shopping, but after brain injury, this can be disrupted. And so again, just a task that, in this case, a task that we've engaged in almost all of our lives, now becomes a challenge to solve what we would in the past consider not even a problem, an issue with problem solving or navigating the world, but now it is a challenge. And again, these all cause and result in feelings of anxiety, feelings of depression, and so that helps us actually move into this next category, talking and socializing. Again, as we mentioned in earlier slides, brain injury can lead to difficulties with sort of remembering and trying to think of the right word to express the thoughts and ideas that we're trying to communicate or relate to others. And then also along the same lines, just the whole communication process in general. Understanding questions and thoughts that are being either asked or shared with you. So just the whole understanding of what's trying to be communicated. And then also it coupled with the challenge of sort of producing or sharing ideas and thoughts are often challenged after brain injury. And then we think about processing information. So if we're already having difficulty sort of understanding what's being shared with us, and then we're also finding it difficult to then respond or to then share our thoughts and ideas with others, this is compounded by the challenges that are presented by the disruption in being able to process information in and of itself. And again, these all sort of combine to create an environment in which folks may feel anxious and challenged in sort of socializing. It also may have folks feel that they may need to isolate because they're feeling challenged. They are feeling overwhelmed by all of these barriers that are now present and these changes that have happened after sustaining a brain injury. The emotional regulation and behavioral piece is often incredibly disconcerting for folks after brain injury. We often see a lack of motivation and the lack of being able to initiate activities, say cleaning the house or going to church, or reaching out to friends for dinner. And then you have psychological conditions that may occur after brain injury as well. And if an individual, you may already have um, a mental health condition, this can be exacerbated after brain injury. And then the emotional regulation piece is also present or can be present after brain injury. So this idea that folks may be, after brain injury, may be very excited and very happy in one moment, and then 10 minutes later are expressing and showing agitation, frustration, anger, sadness, depression, and after brain injury sometimes for certain individuals, this emotional regulation can be even more challenging. And again, we'll talk about strategies not only to prevent, but also strategies to be able to progress from all of these changes that may occur for individuals after brain injury. And then also after brain injury, personality changes may happen. Folks may experience personality changes. For instance, we may know a loved one who's always laughing and joking, who's mischievous. And after brain injury, they may self-isolate, they may experience or express feelings of sadness, they may be more reserved, they may be quieter, and this presents this is presenting a significant personality change for an individual, and is very concerning. And again, we'll talk about next steps and strategies and coping mechanisms as we move forward. So when we think about traumatic brain injury or acquired brain injury, we ask ourselves, or folks, when I talk to folks, they'll ask, well, I thought traumatic or brain injury meant that you lost consciousness, or you got your bell rung, so to speak. And that's not always the case. As we see here, we've sort of broken it down into sort of three categories, of three gradations of severity as it relates to brain injury. So we have mild traumatic brain injury, which is the most common. And in terms of mild TBI, we'll see brief, or if any, loss of consciousness. There may be some vomiting and dizziness. An individual may feel a little lethargic. There may be some temporary memory loss. However, mild traumatic brain injury is often not seen on brain imaging scans, so X-rays or MRIs. Next we move down to moderate TBI. Now, with moderate TBI, and you'll see here in a second, severe TBI, unconsciousness is likely to occur, and unconsciousness up to 24 hours is sort of a working sort of idea when we think about moderate TBI. We think about contusions and bleeding in the brain, and in this case, because of the contusions and bleeding, neuroimaging will then show signs of injury to the brain. And then we move to severe traumatic brain injury. And when we think about severe TBI, we think about unconsciousness lasting longer than 24 hours. So this idea of an individual being in a coma, and again, neuroimaging will show signs of injury to the brain. So let's meet two folks. First, we have Richard. He's a grandfather. He worked very hard worker, and Richard's 81 years old. Richard's a little hard of hearing and limited peripheral vision. This is part of aging. Um, he previously drove trucks for a steel company, is incredibly independent. Unfortunately, Richard fell outside and he hit his head on a concrete porch. Now, Richard took the right steps. He did everything exactly the way a person is supposed to after sustaining a fall. He went to the emergency department and he had his neurological scans, and they all came back normal. And fortunately, Richard was discharged with no limitations. However, in this case, we understand that this is a mild traumatic brain injury, and Richard is still experiencing daily headaches, and he's having some vision trouble, and some ringing in the ears, which may make us think that he may be experiencing some vestibular challenges or some concerns about his vestibular system. So we would, in this case, as we hear Richard's story, we are ecstatic that he took the right steps immediately after sustaining his fall. However, we as supports and caregivers and advocates, we would want to continually encourage Richard to visit his primary care physician to make sure that he's having conversations about what's going on with his headaches, and seeing his ophthalmologist about his vision challenges, and also encouraging him to go to an ear, nose, and throat medical professional to look in to sort of the ringing of the ears, or to really look at his vestibular system in this case. Now we have the opportunity to meet Elaine. Elaine, she's a mother. She's 69 years old. She moved from New York to North Carolina, and to be close to her family. Unfortunately, Elaine fell in 2019, and she now has to live with her daughter. Unfortunately, Elaine is unable to speak aside from yes and no. So sort of basic communication here. Communication has been impacted dramatically. She is not able to walk or make purposeful movements. Elaine also has to have medical professional care support come in, home health care, healthcare professionals come in at night and sometimes during the day to assist Elaine and her daughter. And Elaine also, as a result of her fall, unfortunately, she requires a motorized wheelchair, a lift to go in and out of the house, also an accessible van, and home health care and therapy. So Elaine's fall is tremendously more serious than what Richard, or the impacts of Elaine's fall impacted. Elaine's fall was more impactful when we think about sort of Richard's story. And in this case, Elaine's fall is more along the lines of a moderate to slightly severe traumatic brain injury. And in this case, we would want to support Elaine's family or caregivers in connecting them with all of the community resources that they would need. Fortunately, in this case, there is home health care, there's CNAs coming out, there are OT and PT therapists that are supporting Elaine and her daughter to help her sort of regain or to make the best quality of life that she's able to have at this point. So why care about falls and brain injury? As we mentioned, in the beginning of our conversation, that falls are the leading cause for brain injury for older adults. So when we think about folks who are or older adults, folks who are 65 years or older, um, when we think about mortality rates, the highest rates of folks not surviving a fall typically occur within the first 48 hours. And this is regardless of age or injury severity. Um, However, we know that as we age, and as we mentioned before, falls occur more in the older adult population. Um, and so, in thinking about that, we also see an increased presence in chronic diseases, in terms of heart disease, diabetes, cancer, et cetera, that also increase the mortality rate. So not only do we have the fall of the brain injury in this case, but this is also exacerbated by the presence of any chronic illnesses that the individual may have. So when we think about sort of the functional outcome piece, it's less favorable for individuals who are 60 years and older. And then there's also a longer period of rehabilitation that's needed. And we also understand that there are higher levels of disabilities or that occur as well. In terms of the cognition piece, again, we mentioned this earlier, but there is accelerated decline in thinking and processing information as a result of the fall. TBI is a risk factor for the development of dementia diseases and Alzheimer's disease as well. So again, when we think about falls and brain injury, particularly for older adults, we want to be aware and conscious of brain structure and circulation, as well as medications that are taken, like blood thinners. We also want to understand a fall history, or the history of falls that folks may have experienced in their past. We know that half of the people who fall will in fact fall again within the next 12 months. And in addition to knowing this, we also understand and recognize that the fear of falling is very real. And this causes, or may cause, a tremendous amount of anxiety. And not only does it increase anxiety, but this anxiety also results in the reduction of activity. So, this, affects the social part of an individual's life. This also may lead to self-isolation. And then we also think about changes in the muscular system, decreased or altered strength, tone and flexibility and balance. And these are also can be exacerbated by medications that folks take. So it's understood or thought that individuals who are older adults, and in this particular case, who are taking 4 or more prescribed medications, this significantly increases their risk for falls. And this also increases their risk for disturbances and their vision, visual, spatial, and the vestibular systems as well. So caregivers have reported mood changes, and we discussed this a little earlier. After brain injury, this has the impact to change how an individual sort of understand their ability to understand who they are. After brain injury, as we mentioned, there are changes, lots of changes that occur that sort of change the person that we used to be. And this is incredibly challenging. This is challenging because now we have to get to know ourselves again, reorient ourselves to this new person that has emerged as a result of sustaining a brain injury. So caregivers, we want to encourage caregivers and help caregivers understand and recognize, as well as the community at large, that folks, again, may experience mood changes, feelings of helplessness and worthlessness, feelings of anxiety. And this can be up to 13 months post TBI. And again, it's important when we think about supports, community supports, we want to make sure that we are encouraging folks to not only look at the or to treat the physical disturbances or challenges or impacts of brain injury, but we also want to encourage folks to focus and take care of the mental health component of traumatic brain injury as well. Then we have the psychosocial component. So we think about emotions and emotional regulation that also need to be addressed. So folks often report, or caregivers often report, feeling irritable, sleep disturbances, challenges in memory, and dependence, having to depend on friends and their loved ones as greatest concerns. And in fact, higher rates of depression, anxiety, and somatic distress are present or become more present. When we think about the social, primarily the social component, we understand and recognize that there are fewer return to work rates, but less impairment in the areas of relationships, work, and domestic activities with developed networks. So just to sort of think about why I care about falls and brain injuries. One, we want to help reduce, again, falls, but then we also want to have folks live the happiest, healthiest life they're able to live. And if we are then able to prevent or help folks think about how to best prevent falls in their homes while they're out and about, we are then able to sort of not have to think about all of these concerns or disturbances or challenges or changes in an individual's life that occur or that have a high propensity to occur after brain injury. However, having said that, in the event that an individual has experienced a fall, it is incredibly and essentially important that we are aware of all of the challenges that are now presented or part of an individual's ability to thrive and to live and experience the life that they knew prior to their brain injury. In addition to that, it's also important that we are aware of these challenges so that we are now able to be able to build and provide the safety nets that individuals will need to be able to thrive and move forward. So what to expect? So again, I just want to reiterate, what does it feel like in this case after a concussion? So we're thinking about BI at this point. Things are challenging. Difficulty thinking clearly, feeling slowed down or lethargic, difficulty concentrating with what's going on, difficulty remembering and processing new information, and experiencing a slurred or difficult speech. And then again, we have the emotional and the mood component, feeling irritable, the sadness component, more emotional, feeling a bit more nervous and anxious, Then in terms of the physical senses, the experiences of having frequent headaches, uh, feeling nauseous or vomiting earlier on, imbalance or dizziness, disturbances in vision, again, feeling tired, and then, sleeping more or less than usual, and trouble falling or staying asleep. Uh, we mention all of these, and we are talking about all of these experiences and challenges that happen after experiencing brain injury, uh, really to say that, or to make the point that it is so important uh, for individuals to seek medical uh, treatment after having sustained a brain injury. The idea of sleeping it off, the idea of taking an ibuprofen or Tylenol after a fall, or after a mild traumatic brain injury, is not um, is not effective. We always want to ensure that folks are seeking treatment or advice or being seen by a medical professional, so that uh, all of these components, all of these disturbances and challenges don't become exacerbated and grow or become worse as time goes on. So after having experienced a concussion, again, as I mentioned earlier, it's absolutely important that individuals who've experienced concussion seek the advice of a medical professional, uh, making sure to stay hydrated and eating a healthy diet, uh, getting plenty of rest within the first 48 hours of injury. And when starting activities, start slowly. Don't over exaggerate. We want to encourage folks not to just jump in with all of the energy and both legs. We want to encourage people not to overexert themselves, or continuing when experiencing the symptoms that we just talked about. Getting plenty of rest and sleep and taking breaks, not pushing oneself too hard. And it's also important to encourage folks to avoid caffeine and, energy enhancing products, the energy drinks and so on and so forth. Also avoiding smoking and sort of substances at this point. So drinking alcohol, or making sure not to, or to think about, or to seek medical professionals' advice about taking over-the-counter medications unless it's prescribed. For instance, certain cold medicines have active ingredients that can cause you to feel tired, that can impact or affect your ability to think clearly. So again, we want to encourage folks, particularly for over-the-counter medications, to seek medical professionals' guidance before taking those. And also avoiding activities that are physically demanding or require a lot of thinking. So, the take-home points here are: one, after experiencing concussion, go see a medical professional. Make sure you're staying hydrated, resting, not exerting yourself, avoiding substance use, and just staying away from physically or tiring activities that require your brain to think really hard. We need to rest the brain, rest our bodies, hydrate our bodies, eat right. And again, most importantly, we need to make sure that we're encouraging folks to seek the advice of a medical professional. So here's some warning signs that we want to share with people about what it looks like, what a concussion looks like. What are some of the signs and symptoms that we want to pay a close attention to if we suspect someone may have experienced a concussion? One pupil may be larger than the other. Vomiting, we talked about this earlier, but vomiting or feeling nauseous can be present. shortly after a concussion or brain injury, severe or worsening headaches that just do not go away, sleep disturbances, feeling tired and lethargic, changes in mood and personality, changes in our ability or an individual's ability to think and process information, feeling agitated, slurred speech, feeling weakness or numbness in our muscles, having seizures or convulsions, difficulty with walking or balance, having difficulty maintaining one's gait and balance, excuse me, are also signs. We've mentioned this several times, but there may be difficulty with one's vision. Loss of consciousness, passed out or having your bell rung may be a big sign of concussion. And really just any symptom that may concern you or your family members or friends about your loved one or anyone, in fact, who you suspect may have sustained or who is experiencing or has experienced a concussion. So let's talk about the good stuff. Let's talk about what strategies we can put in place to help folks prevent falling. So let's play crossword. Our word search, sorry. So we talked earlier in the beginning of our conversation about age and that being a significant factor with respect to falls and brain injury. So let's think about some prevention strategies that we can help folks put in place to reduce the likelihood of experiencing a fall and head injury that is coupled with that, with having experienced a fall or falling. So, as we age, it's, as we mentioned before, it's incredibly important to have more frequent health checks, particularly after age 60. In terms of history, as we mentioned before, it's important to know if an individual has a history of falls. And we also talked about after, particularly older adults, having experienced a fall, it is likely that that individual will fall again within the next 12 months. So knowing all of this information is important because then it allows us to help encourage and support folks or an individual to seek a falls assessment if they in fact have experienced a fall in the past. When we think about the anxiety piece, particularly as individuals as we age, sometimes we get a little nervous walking upstairs or walking downstairs, or walking on a narrow, uneven sidewalk, or climbing the ladder to clean the leaves out of the gutters during the fall. So, if individuals are experiencing fear and anxiety about falling, then it's important for us as loved ones, caregivers, and community supports to encourage individuals to seek counseling or relaxation strategies, implementing mindfulness strategies, talking to spending time with friends and expressing concerns and feelings about anxieties about not always feeling steady, and being supportive and helping find environmental supports and changes that can be made to help folks feel more confident. And we'll talk about some of those things in just a bit. We focused a little bit on sort of the impact that brain injury can have on our muscular system. And so we want to encourage folks to be active, uh, to go walking, to participate in workout activities. For instance, maybe joining the local YMCA and doing dance classes or step classes or stretch classes or core classes. And this not only one helps build core muscle strength, but this also plays an important role in helping folks feel more social and connected in their community as well. Medicine plays a huge role in impacting or affecting an individual's sort of steadiness or their ability to think clearly when we think about cognition and so on and so forth. And we mentioned earlier that individuals who may be taking foreign medicines or more are at a higher rate of experiencing a fall. So we want to encourage folks, when they're at Walmart or CVS or Walgreens or any of the pharmacies, to contact your pharmacist or doctor. Go to the consultation line at the pharmacy to make sure folks are asking about the interactions and the side effects or any concerns about the medication they're taking. And it's also a great idea to be present with your cared loved one as an older adult, to be present with them at the pharmacist's consultation window, or to be present at a doctor's appointment, to make sure that all the right questions are being asked, so that we can ensure that we have all the pieces of the puzzle that we can put together to make sure that we can develop an effective plan to help our loved ones, our community members, reduce the likelihood of, again, falling as a result of the side effects of any medications that they may have to take. As we age, it's important to get regular vision, hearing, and balance checks. The vestibular system, it plays the most important role in how we maintain our balance, how we're able to sort of walk and be steady. And so we want to make sure that our eyes are seeing things as best they can, that we are able to hear and as well as we can, and that the vision and the hearing components come together to help us be more balanced. This also allows us to help understand where we are in time and space. And again, it's in addition, coupled with these pieces, we also want to encourage folks to wear any devices as prescribed. This means a hearing aid. This means using a device that helps folks walk more steadily and to stay balanced. So again, we want to help encourage and be a support for our loved ones, for our community members, for folks in our lives who are aging, to make sure that they are receiving or participating in regular health checks, to make sure that they are taking all of the right precautions and putting all of the right pieces in place to reduce the propensity for falls. And then it's also important to address and to talk about, are there any balance or dizziness difficulties that are being experienced? Are you feeling any pain? Is there any swelling or numbness in the foot or the extremities? And this conversation not only leads to, or talking about the regular checkups, but it also helps us support our loved ones, our community members who may have a chronic illness, say diabetes or cancer or heart problems. Because not only do we want individuals to get those regular checkups, but we also want to make sure and are encouraging and supporting folks to put in all of the right or participate in all of the right interventions to help reduce the challenges from chronic illnesses. So this is sort of a two-part strategy here, doing regular health checks, but also making sure that folks feel supported and are encouraged and know what to do to help maintain a steady state with chronic illnesses that they may be experiencing. So it's also important when we think about the effects. It's important to avoid multitasking often, and again, important to take breaks to prevent from feeling overwhelmed and fatigued. And again, when we think about sort of the psychosocial, social component of life, in the event that we are seeing signs of anxiety and stress or depression or sadness or just significant changes in mood, we want to, again, help folks and encourage folks to seek counseling to provide that social support. Something as simple as sitting on the front porch on Sunday or going to the local senior center in the community and participating in those activities. Relaxation activities, for instance, seated Tai Chi is amazing for helping to reduce stress and anxiety and to participate or to engage in a mindfulness activity. And in terms, we spoke about this a little earlier, but with respect to the chronic illness piece, followers seek out pain, encourage healthy eating, balanced nutrition, and think about finding best practices for chronic management programs that exist in the community to help support the management of chronic illnesses for folks. Again, it's important to address any medications and reduce or abstain from alcohol and substance use, and to always stay hydrated. So again, we do want to encourage folks to be aware of all of the side effects of the medications that they're taking, making sure that they are asking their medical professionals, all of the questions they need to know about what's being prescribed for them. And if not, their medical care provider, the pharmacist, is also there and are able to help and folks better understand all of the side effects that may be a part of taking medications of which they are prescribed. So going back to activities, it's important to seek ways to make activities safer. We don't want to not be active. We want to encourage folks to be active. So some of the supports that we can put in place are making sure that folks are wearing the right shoes, for instance, that there are stabilizing equipment available, that there are rails, for instance, in the bathrooms that are in bathrooms for folks to hold on to, or that there are rails along the stairs that go to the second floor of the house when riding bikes. Making sure that we're wearing helmets or folks who are wearing helmets. Very simple ways to help prevent falls and to make being active safer. So I believe I mentioned this earlier, but the environmental component of falls prevention is essentially critical. So the idea of doing a home assessment and looking at what an individual's environment looks like. So for instance, secure rugs. This can simply be done with for instance, the mats or the the tape that you can use to help secure rug to the floor so that the edges folded over don't cause an individual to trip or fall. Reducing clutter, getting brighter lights, or motion or smart lights can also be used. Having grab bars or railings and functional and accessible storage are also encouraged to help create an environment that is safer and less likely to cause an individual to fall or to trip. So collaboration in the community. What is our role? And I know I've talked a bit about this. I've talked a lot about how we can be a support to our loved ones and to the folks in our community. But more specifically, let's look at some of the support strategies. Sorry about that. Let me go back. So it's important to be patient. Having patience is key. So again, we want to help folks feel relaxed, reduce anxiety about experiencing a fall. So for instance, if an individual may say, "Oh gosh, I have those steps and to go upstairs in the house. I just don't like to go upstairs anymore." Well, let's help our loved one, in this case, reduce anxiety about the fear of falling. And this can be done simply by just taking deep breaths, participating in mindful exercise when feeling overwhelmed, or really just having a conversation about, well, why do you feel nervous? Why do you feel anxious about going up the stairs? What can we do? What can be done to help you feel more confident and less anxious? It's also important to ask questions to help with problem solving instead of coming in and assuming that your ideas are the right ideas to solve the problem that may exist. We all like to be independent, and we all like to use our thoughts to solve the problems that that are presented to us. So again, this idea of working together, having a partnership with respect to problem solving. Simplicity is always best. So in this case, we want to reduce stimulation or distractions. We want to break our tasks or our chores and goals into smaller, more manageable components. We don't have to plant the garden all in one day. We can turn the soil over on Tuesday. We can till the rows on Wednesday. We can fertilize and put the seeds and cover them up on Friday. And so we planted the garden. We didn't have to do it all in one day. We broke it up into 3 days. And by Saturday, we can sit on the porch and just wait for our plants to start growing. It's important, folks, we like options. So give options to help with indecision or limited motivation. This is important because, again, this gives folks or provide folks an opportunity, again, to be independent thinkers, to help with thinking through the components of decision making, by providing folks with the ability to negotiate and navigate all of the the options that are available to them to help make a decision or to accomplish a task. So again, we want to make things as simple as possible, but also what's most important here is to have open conversation to help folks think through decisions or activities or tasks or chores that need to be made or completed. And then it's important to be creative. It's helpful to tie activities and goals and learning to an individual's interests, hobbies, and past. So for instance, if for instance, again, I like to garden. So if a person is interested, if gardening is a passion for them, then, use gardening ideas or metaphors or gardening strategies and tie them into one, creating more activities with which someone may be able to engage. Use that as a framework to create goals, to set goals, and then also using that as a framework to help with learning strategies, learning new information, making the connections between that person's interests and hobbies and the learning of new skills or practicing new memory techniques, for instance, to help with reducing stress, if that in fact is a goal. Or to become more active. So creativity plays, again, a vital role in terms of support strategies. One, to help build cognition, to help with decision making, to help with the psychosocial piece, to help with just being engaged. So these are just some support strategies that we may want to keep in mind when helping individuals and assisting folks in sort of reducing their concerns, reducing their fears, reducing their anxieties, helping folks feel more confident, and helping folks feel more dependent and feel less dependent on caregivers and family members as we age and grow older. It's also important to plan ahead. So not just developing a plan for safety, but also alternatives to behaviors and overwhelming feelings. So for instance, an idea if an individual may feel overwhelmed by going down the basement to the deep freezer to get food out for Sunday dinner, then let's talk about an alternative. Why are you feeling overwhelmed? Or what can we do to change you having to walk down the basement stairs? Maybe we think about moving the food, in this case, to a more accessible space in the home. It's also important to connect and make aware of community resources that exist. For instance, the senior centers that are in local communities, or for instance, if there is a walking group on the community greenway, or if there are any sort of community events or groups that exist. The point here is to be a part of that process of making that connection and being there to support, not just physical support, but also sort of that emotional support, the feeling of providing that feeling of you have a cheerleader in me here and I am right here with you. So it's okay to have new experiences, to meet new people, to engage in different ways, because I'll be right here with you as you continue to make these new connections. Using technology is so incredible and vital. As we see now, there are so many there are a ton of devices, assistive devices, watches and phones and so on and so forth, that make life much more manageable in terms of tools with remembering, creating lists, being connected to doctors, to family members, to grandkids, to connecting with friends. However, it's important not to just say, hi, mom, hi, dad, here's a brand new iPhone, or an Apple Watch. We want to be mindful that we, again, make this technology accessible and easy to use for our family members. So, the idea is that we may want to set it up for them and use all of the accessibility features that are a part of all of the technologies that are available for us. And this moves us, well, this is a great transition, allow time to sort of show our loved one how to use this technology, or identify sort of, mom, you don't have to use all of these apps. Here are, here's how you're going to use this device. Here's how you're going to make calls. This is how you call me. This is how you call your doctor. This is how you text niece, nephew, and grandkids. And this is what you need to do in case there is an emergency. So, we are encouraging the use and all of the benefits of utilizing technology, but at the same time, it's important not only to make using technology accessible, but also explaining how that technology can be used, not only how it can be used, but the method with which they are able to deploy or utilize the technology. And then we also want to identify barriers as we provide what are the best support strategies, consideration, difficulty communicating, whether that's not, making a phone call, not having a device to make a phone call, or being in contact with, for instance, being able to contact doctors or family members, the ability to process, for processing information, sort of there's some cognitive difficulties, memory issues. And then also, we want to take physical barriers that may limit activity. And, in identifying, the barriers, this allows us, again, to be creative in how we're able to provide folks with the supports that they need, so folks can be more active, so that they are able to enjoy their space and their time in the world around the folks and that they care about and the things that are important to them. So overall, falls can happen to anyone, regardless of age, particularly when you're not prepared. And again, consequences can range from minor to fatal, as we talked about earlier. And again, I want to take a moment to reiterate the importance of following up and having those necessary assessments. Again, always consult with medical care providers, doctors after a fall with symptoms present. And I also want to say, even when there are not symptoms present, we want to encourage individuals, our loved ones, to consult with their medical care provider. And then like today, we want to educate people on the symptoms to watch out for, even when even when an individual has not blacked out as a result of a fall. And then prevention and wellness. Take action first to prevent injury later is sort of the take home point. And again, we want to share as many resources and seek wellness and incorporate positive habits to prevent falls in all areas of life. And I'll make a plug for the Brain Injury Association of North Carolina. We have an incredible neuro resource facilitator, and essentially what that means is we have a great person on our team that you can connect with, and she has a tremendous host of resources available to her. And I know that she is always excited and always so incredibly happy to connect folks with all of the right resources they need for them to help them thrive and to live the best, most well-lived life possible. So as I'm winding down, again, I'd like to take a moment just to talk about what Brain Injury Association of North Carolina is doing. We are presenting a webinar series throughout this year, and we are calling it Thriving Through Education. It's a speaker series. And our next Thriving Through Education speaker will be Dr. Pat Babin. And she's going to talk about sexual and relationship health after brain injury. And that's on October 12th. And then in November, we have Preventing Depression After Brain Injury. And we're going to have in February, we'll have the folks from the Food Bank of Central and Eastern North Carolina talk about the importance of nutrition and staying healthy after brain injury. And then in the spring of next year, we'll have Dr. Wing Ing, who is the director of the neuro unit at Wake Med in Raleigh, talking about traumatic brain injury and transitioning home from the hospital. And then we'll have Dr. Laura Leach from Wake Med Hospital as well, talk about recovery. Recovery from TBI is a process. So I'd like to encourage all of you to participate and join in on our Thriving Through Education speaker series. We have some amazing speakers with just terrific information that they will be sharing with us. Oh, and to register, just visit the Brain Injury Association of North Carolina's website to register for the series, and it's all no cost. We want to encourage as many people to participate as possible. So I'd just like to take a minute to sort of wrap up this morning. And if you will do me a huge favor, I'd really enjoy having you share your thoughts with us here at the Brain Injury Association of North Carolina. The presentation will be made available to everyone. However, if you'd just like to take out your mobile device and scan that QR code, I promise the questionnaire is very short, but it would be so meaningful to me if you would just take a brief moment to just share your thoughts about our discussion, our conversation this morning. And so I wanted to take a minute to highlight some resources and references that I put together for everyone participating and joining us this morning. It's a list of just some incredible resources and organizations who are leading the forefront in falls prevention and helping to educate folks about preventing falls, but then also these resources sort of share a lot of information about non-traumatic and traumatic brain injury and what it looks like, what they look like, and how to find and seek out the right help and information you need, individuals need, to better understand what the next steps are. One, to prevent falls, and to help after brain injury. So I'd like to turn it over to Kristen to talk about what is a matter of balance.
Brad, for the sake of time, I think we are going to skip the matter of balance portion. I know we went a little over, so we are just going to go ahead and close out for today. Unless Kristen, unless you want to share.
It's okay. I won't keep anyone any longer. My contact information is on the PowerPoint. So when it's shared, if you want to reach out to me to learn more about matter of balance and how to get involved, feel free to.
And then I've seen a lot of questions about getting the QR code and the presentation and all of that. I will send out Brad's presentation, so the QR code will be on there. You guys will get a certificate of attendance. It'll be posted on our website, all of that good stuff. I'm going to go ahead and throw in the chat the link to sign up for any upcoming webinars, and feel free to check back there pretty frequently because we update that quite a bit. So thank you guys for being with us today. Thank you, Brad, so much. I'm seeing a lot of positive feedback in the chat. It was great to have you.
Well, thank you. Thank you. And thank you everyone for joining, and thank you all for allowing me to share this information.
Awesome. All right, guys, we'll see you next time.